being exposed. Distributed salt disease where this is called it is particularly causes Hunter-Russell syndrome. Hunter organic mercury. This chemical. Only and I mean audible useful connections. Mercury levels reflects a long measuring supportive care, decontamination, and chelation therapy. Treatment is with gastric level is 2.5% sodium bicarbonate and British anti-leaf carbonate that are present from reported from India, particularly in South in Tamil Nadu that are reported in the this review, but the exactly reported were there. One element found later similar 9-month-old vaccination reported. Am I audible? Yeah. Acute exposure, hair and less mercury exposure, urine, and the cutoff blood level is more than 30. We are going to interview. And the treatment is with gastric level is 2.5% sodium bicarbonate and British anti-leaf said D-penicillamine and supportive therapy. There are few case reports and literature that are present from a reporter from India, particularly in South in Tamil Nadu. In Chidambaram, they have reported oral mercury administration in newborns that is followed as a traditional practice in rural areas that presents as a systemic illness like septicemia and perforation and abdomen distension, and very mortalities are reported in this review. But the form of mercury that is being given is not exactly reported. And few other literature reviews are there. One elemental found later found to our Mexican department with the features of acute gastroenteritis. Same way, X-ray was taken and there was radioactive material found and there was history of ingestion of mercury. And so to conclude, the elemental mercury ingestion in this our case, there is no inhalation. The absence of inhalation, it is not toxic. And the symptoms of poor sensorium, encephalopathy, vomiting were well explained by the late onset sepsis and meningitis. X-ray findings in this case and mercury injection in this case is purely incidental. This is normal. The baby was unlikely to have toxicity. And the follow-up X-rays also ensure that to ensure that the passage of the material is the baby has get rid of all this material. That's just following up to the neurological manifestations in the baby that can be caused. So we will have a long-term follow-up of this baby for the neurological manifestations of the supposed if at all situations. And during our follow-up, the baby was found to be well thriving without any symptoms. And so thank you. Thank you for patient attention. Any questions? I'll be happy to answer. Shall we end?
Yeah, I have, good evening. I'm Dr. Alimelu from Nilofa Hospital. Hello.
Hello. Yes, madam. Can hear you.
Yeah. I had one doubt. Did you find any mercury, like was it present even in the lungs, X-ray chest which you took?
Ma'am, in our X-ray, we couldn't find any radiopaque material in the chest, ma'am.
Okay. So this was like just one dose or one time injection which the grandmother had given, or was it several times?
It was given over 2 days, ma'am. 2 days,
Okay.
maybe 2 times or 3 times a day. The baby was being
Okay.
given this.
Yeah, because I have I have seen such cases in one of the districts of Telangana. So they believe that it is it acts as an anti-infective and prevents repeated infections. So sometimes they do put it as young as 5 days in neonate to up to 1.5 years or even 2 years of age. So I've seen in all kinds of ages, and the most toxic thing immediately is when the neonate aspirates into the lung, even if they're giving orally. So they may give it either orally or they may put it into nostrils as well. So the most toxic immediate effect would be the inhalation of the mercury vapors, which actually makes the child have a kind of chemical pneumonitis. So I think fortunately this neonate didn't have it. And did you all follow up? How long did the mercury stay in the intestine?
And diapers, ma'am?
No. When did you repeat an X-ray?
Yeah, we
Abdomen?
repeated discharge, and in follow-up, we didn't do that.
Okay. I
Actually,
have followed up.
since the baby had, we did not do, but we plan to do at the end of 1 month. Next month, we are planning to do.
Yeah, I have followed up few neonates who had the residual X-ray densities remained for more than 2 to 3 months as well. And there was a neonate with Down syndrome where I think I followed that child more than 9 months, and it persisted for a very long time. I don't know whether they'll be excreting that easily. Yeah, I think, like you said, we need to follow. We need to keep doing the levels, serum mercury levels, because one sample, I don't know whether it would be enough. Anyway, a very interesting case, and good workup and good presentation.
Thank you. Thank you.
Good, Dr. Arun.
Thank you. Thank you for your question. Any other questions? Shall we wrap up? Thank you. Thank you for patient listening. And thank you for this opportunity.